Welcome to the Kaleidoscope of Possibilities, Alternative Perspectives on Mental Health. My name is Dr. Adriana Popescu. I'm a licensed clinical psychologist and leader in the field of mental health, energy psychology, addiction, trauma, and empowerment. In this podcast, we will be exploring mental health from a variety of perspectives, from the spiritual to the shamanic and beyond. What if mental illness isn't everything we think it is? What if everything we see as a pathology is actually a possibility? What else is possible with mental health? Hi, everyone. Dr. Adriana Popescu here with you today with another episode of Kaleidoscope of Possibilities, Alternative Perspectives on Mental Health. I'm very happy to have with me today Kari Halligan. She is a professional registered nurse and holistic pelvic care practitioner. She's also trained in Maya abdominal therapy, energy medicine, and shamanic practices. With her knowledge and wisdom of foundational and functional medicine, she facilitates a healing and clearing environment. Women are able to ignite their own flame of feminine power and authority. Old patterns, outdated beliefs, and stagnant energies can be examined and released with guidance, understanding, and wisdom. Kari helps facilitate that journey as she is a weaver with many tools and much knowledge. Each person's journey is sacred and honored with her guidance and presence. Welcome, Kari.
Thank you. Thank you for having me today. It's kind of interesting that I've heard a new term going around about Galentine's Day and talking about our lady parts together. So some synchronicity maybe there. I don't know.
Perfect timing. Yeah. Yes.
Yes.
So I always like to start off the show with finding out more about our guests. So tell us a little bit more about yourself, your work. How did you come to do this kind of work?
So since my background, I grew up on a ranch in Montana, and have always been fascinated with birth for whatever reason, and ended up becoming a labor and delivery postpartum nurse and having my own children. I then was working nights, had 2 children under the age of 2, was breastfeeding and was exhausted, and was looking for something else to kind of do along the same lines. I've always loved women and women's health. And I was talking to a friend of mine who's also an energy intuitive, and she had mentioned this woman to me prior, and I tried to get in contact with her. And at the time, we weren't able to connect. And so a couple of years later, I was talking to this friend of mine again, and she mentioned this woman again, and said that you guys should connect. I think you have a lot in common. She's now written a book, you could check it out. And so I was like, okay, I'll do that. And then I was like, nah, I was like, oh, maybe not. And my daughter, who was about 1.5 years at the time, found a sticky note with this woman's name and put it in the middle of my dining table with nothing else on it. So I said, fine, I will go buy her book. So I went to the bookstore. I went to go buy her book. I picked it up. I looked at it for whatever reason. I put it back down. And then I was like, no, I came here to buy this book. Take the book up to the cash register. And I'm checking it out. And they're like, she's talking this weekend here. And I was like, okay, I will go. And so I went and listened to her talk, and then ended up going in and training with her. Her name is Tammy. And she's also a physical therapist and has become one of my teachers, which brought me into doing the holistic pelvic care. And then from there, started doing the Mayan abdominal therapy, the shamanic work and energy medicine. Part of that's just been part of my upbringing. My mom was also kind of an intuitive who, I've just kind of been led along that path. So, and it's just brought me to where I am today.
Yeah. Super interesting. Yeah. So often, right, it's through our own journeys that we end up and often finding maybe limitations, like I've shared on the show that I had a 17-year history with Lyme disease and chronic fatigue, and I didn't, Western medicine didn't have a lot for me. And so I was always looking for like alternative therapies for my own healing, and then found all these amazing tools that were so useful for my clients. So I started bringing it into the work that I do. So your journey is an interesting one that led you to what you're doing now. So yeah, let's find out more. What is holistic pelvic care? What does that mean even?
So holistic pelvic care is a type of internal pelvic floor work that also uses breath work and some energy medicine to clear out what is referred to kind of lovingly as the pelvic bowl. I think a lot of times people just kind of think of their pelvic bowl as kind of more of a kind of like a hammock with one big muscle, but it's not. It's actually consists of 14 different muscles. And then there are also ligaments and fascia that kind of creates this casing around the muscles and protection, and it should be smooth. And then there's also lymph flow, blood flow, that all go through this area, the pelvic floor, and that creates the stabilization for the reproductive and your upper body, as well as the communication down to your lower body. So the kind of everything should be working synergistically together. Sometimes when people have trauma in their life, that could be something from their childhood. It could just be a fall to your sacrum. It could be a car accident. It could be childbirth. It could be emotional trauma. Sometimes that gets stored in the pelvic organs, the musculature, the fascia can get bunched up, can cause tension points, trigger points. And so through this holistic pelvic care, which is kind of usually hands-on, but you could also do at distance or energetically, kind of working with the organs to release the stuck energy, muscles, fascia, to release, and then creating more balance in your body and thus also in your life. So
Yeah, I think this is a part of the body that is certainly overlooked, right, by many people. And I guess I would want to know, well, how does someone know they have an issue down there? Like, what would be some of the symptoms that would lead them to seek out this kind of therapy?
so just on a physical level, pain with intercourse, any sort of urinary leakage, difficulty with bowel movements, like low back pain, feeling like your hips are out of alignment, can't sit right, basically digestive issues, just feeling of tension. Those are all signs that you could benefit from some sort of pelvic floor health therapy.
That's actually bigger than I would have thought. Yeah, like I might have like considered, like, certainly I've heard many stories from women who've had difficult childbirths and things get torn, and things can get real wonky from that. But even digestive issues, that's interesting to me.
Mm-hmm.
So like, is it because there's like inflammation happening, or what's the connection there?
It could be inflammation. It could be guarding. It could be like emotional guarding. Could be things have shifted in the pelvis, like you're in a car accident or get hit on the side, or you, like I was saying, you fall to your sacrum, and then the organs they can get out of alignment. They can get shifted over to one side or the other. They can be tilted back onto your sacrum, causing that low back pain. Then your colon, is getting pinched. Mm-hmm. And so that can all cause then inflammation and congestion in those lower organs.
Got it. So
and then
oh, sorry, go ahead.
Oh, and then I was going to say, a lot of those muscles and so on, it's hard to get to them from the outside. You can energetically, just by hands-on and with intention, going into your own body and asking them to release is a really great way of working with yourself. But some of it is also hard to kind of, without knowing that as well, doing the hands-on work as well to help release.
Mm-hmm.
that
How
musculature.
how do you so when someone comes to you for this type of work, how do you kind of diagnose what might be going on? Like, is it like a palpation kind of thing? Is it like, I would imagine taking the history of the symptoms and all that, but like, how do you determine, let's say if organs are out of alignment, are you able to determine that just from feeling what's going on?
Yeah, so it's a combination of taking somebody's history and hearing their story, knowing what's going on. That will start to clue you into kind of where to start looking in the body. The hands-on work also, you can palpate and feel the uterus, the bladder internally. If you're working with the internal pelvic floor muscles, you can feel like nodules, trigger points, tension, where the muscles aren't moving synergistically, and where they might be out of balance. You can also just even like look at hip level balance, one side being off, one hip being rotated back further than the other. So a combination of, physical palpation, hearing story, their story, and visually also.
Mm-hmm. Mm-hmm. And so what does the therapy itself look like? And like over maybe how many kinds of sessions? What would a typical case what might that be? I'm sure it varies, but.
It definitely varies. Most people generally tend to like 3 sessions is usually beneficial for most people, to kind of get in there and do, set a new pattern. Sorry, my words weren't coming. So, the first one, it's like they would come in to do a history intake, an evaluation, and doing some release, and then coming back in a couple sessions to kind of reestablish new patterns within the body.
Mm-hmm.
Some people do great after 3 sessions. Some people need some more work, depending on their bodies and like what's going on within their bodies.
Mm-hmm.
So
do you find that after folks get these treatments that the condition seems pretty like permanently altered, or do you find that people may go back into the old the old problem pattern that was creating problems for them before? Do people need to like maybe come back in the future sometimes?
it also depends on the person. Some people will come in a couple of times and they feel like a huge shift in their body. They feel a huge shift in the way that they're sitting, or they'll feel like there was a big like energetic release of something that they were needing to release, and they're good. Other people sometimes, it'll take a few more sessions, and sometimes people do like to come back after, and do a check-in maybe a couple times a year after that, just to kind of, life happens. So things that happen in your life on a daily basis can then sometimes cause more tension, or something comes up that causes them to, for their body, for that a little bit of an imbalance, but it's usually not back to where it was. So it's kind of like for their own self-maintenance. They just enjoy having the work done. They feel like it's beneficial to come back and have kind of a checkup every once in a while.
Mm-hmm. And so is the treatment itself primarily massage and energy work, or what exactly is a treatment consist of?
So for like when we're talking about holistic pelvic care, it usually is primarily, sorry, I think we're just cut out. So for holistic pelvic care, primarily like you come in, we do the evaluation, it's hands-on body work, breath work to kind of help the body release and breathe into tension points and allow the body to kind of relax and restabilize. Work with the ligaments and ligature, stretch receptors so that the organs and muscles are then realigned. Does that answer your question?
It does, yeah, because I think people don't quite understand that this is so many women don't even know, people in general don't know this exists, don't know that this type of work exists. I am good friends with a physical therapist, and from her I've heard a lot, about it. Oftentimes it is, right, like a physical therapist, you're
Mhm.
yourself are a nurse, but that's usually the type of people who are doing this work, right?
Correct. It's usually like a physical therapist, sometimes naturopathic doctors, a nurse. Those are primarily the people that do it. Some massage therapists do, but they do more of the energetic and breath work meditation piece to it, just because of licensure for working with the internal piece of the holistic pelvic care. Massage therapists also do the Mayan abdominal therapy, which is another absolutely wonderful therapy that works more externally on the lower pelvic organs in similar fashion.
Hmm. Yeah, I was going to ask you about that because I've actually not heard of this one before. What is Maya abdominal work?
So my abdominal work was passed down from Don Alejo Ponte, who was a South American shaman in Belize. He passed it down to Rosita Arvigo, who then has been passing it on to other people within the community and the world. So it is also a hands-on technique, talking about the stretch receptor muscles, looking at much of the same thing that I was talking about before, but with more of the external digestion, reproductive health, increases blood flow, lymph flow to those organs, helps with the alignment of the body. So I really like doing the Mayan abdominal together with the holistic pelvic care, because then you get into the digestive organs, the reproductive organs, and then those internal muscles and ligaments that can't really be reached on the outside with that holistic pelvic care, can be addressed.
Hmm.
And you can see a big benefit from doing them.
Yeah, I can imagine for all kinds of, yeah, issues going on there. I would think this would be helpful for ladies who have issues with maybe endometriosis or
Oh,
like polycystic ovarian stuff. Yeah. Yeah.
absolutely. Very much so. People who've done it, there's been stories of people who've done it and then have gone in and had their endometriosis resolved. Definitely helps with PCOS, polycystic ovarian syndrome, with flushing out that lymph flow, getting those digestive and enzymes and going again. If they're also working with a naturopath as well to kind of look at diet, exercise, and those are kind of things that I touch on, and many other clinicians also touch on during a session. Infertility issues,
That's what I was gonna
healing
ask.
from
Yeah.
C-section. There's a beautiful case of a woman who went and had Mayan abdominal therapy done after her C-section, and then she went in to do a repeat C-section, and they couldn't see any scarring from her previous C-section.
Wow, that's amazing. Yeah, because so often with birth, right, whether it's a C-section or a vaginal delivery that's been more difficult, maybe there were complications, there was tearing and stuff. I would imagine there's a lot of scar tissue that you're often having to deal with in this part of the body.
Yes, yes. So there tends to be, after a traumatic birth, and sometimes not even a traumatic birth, just because you're carrying a lot of extra weight, your body's stretching, that relaxin in your body, the ligaments, everything can kind of shift around a little bit and cause bunching of the fascia, tension, misalignment of the structures. And so this work will help to realign that and release it. Also, just working with, like a birth story or somebody who's had previous trauma in their life, somebody that's maybe had any sort of abuse, sexual trauma, or could be verbal trauma. Sometimes that gets trapped in the body. If I'm working with somebody who does have that sort of trauma, like I would say sexual abuse, or abuse in their past history, it's really good and important for them to also have a therapist that they are working with currently. Because once we start working on these areas, a lot of times that stuff starts to unravel and come up, and to have a therapist that they really trust and know to work through some of those emotional aspects that start bubbling up. A lot of the therapists and myself, I like to hold space for that, but there's also unraveling that happens that they need a professional that's specifically trained in therapy to help work through those issues as well.
Yeah, I'm glad you mentioned that, because I think that that piece is really important. I mean, it sounds like the work that you're doing is really powerful, and I can imagine that it might unlock a lot. That's, what some of the trauma experts are calling the trauma capsule. It's like all this unresolved traumatic material that we don't feel like we have the ability to deal with at the time that it happens, kind of gets like repressed and locked away, and we tend to hold that in the body. And so we sometimes don't know, when I consider myself a trauma specialist, but when we open that Pandora's box, we don't always know how it's going to unravel and unfold. And we may not be able to contain it in an hour long or however long the session is, right? And there may be more that unravels afterwards. So I agree. I think having the support of a trained professional who's already working with you in conjunction with doing this type of work could be really beneficial.
Yes, yeah, it could be very powerful. And, sometimes when you're doing this work, all of a sudden a memory will bubble up as you're working with a specific organ or a specific structure. And it starts to bubble up, and that emotion bubbles up. And then to be able to work through that, in my therapy, using breath work and allowing that space for them to have those emotions, but, and then kind of taking those pieces to later work with their therapist. And I feel like a lot of this work that we do together is very synergistic, and using different modalities that can come together and work together can create much more healing. It's not always just, I'm going to one person. Sometimes it takes several people to work through.
Agreed. Yeah. I'm wondering too, if you find sometimes the trauma that comes up for folks isn't even necessarily their own, that there may be intergenerational trauma or ancestral trauma or something like that. Do you find that that's also coming up for your clients?
Absolutely. Definitely a lot of generational trauma that's held in the body, patternings with generational trauma, abuse, scarcity.
Yeah, I could totally see that.
It all comes up.
Yeah. Sorry, we're having a bit of a Zoom challenge. We're a little bit glitches. Our Zoom is glitching out at times, so that's why sometimes we're getting a little a little off on the timing. But at least we're hearing each other. That's the good news. Yeah. So with that, so we talk about trauma,
Yes.
and certainly, so looking a little bit here at the mental health component, which I think is such a misnomer, as if mental health is somehow separate from physical or emotional health, but this is what we call it. But I am curious about what your experience has been with folks, besides who have experienced trauma, but what about people who experience depression or anxiety or some of the more common kind of mental health diagnoses? Like, what do you notice with your work and those issues?
I would say with those sorts of issues, those people tend to have a harder time almost like being in their bodies or connecting into different parts of their bodies. A disconnect with, kind of what I would say being grounded or connecting in and listening to their own wisdom and knowledge. That's generally what I tend to find within them. Calming, it's like working with calming their nervous system down, having presence, a lot of times, like we're taught to find knowledge outside of ourselves, and people with anxiety and depression, it's like they're looking outside of themselves a lot of times for answers, when there's a lot of wisdom within themselves that if they can quiet down long enough and listen to, or sometimes it's hard to listen to that stuff because it's, it could be old past trauma, or they grew up with a mother who was always, worried about them. And so they're always looking for that shoe to drop.
Mhm.
But they're, even though they had a decent upbringing. So kind of learning to kind of pull back in and come back into themselves can really be beneficial or help them, and connecting into their own bodies and their own wisdom to calm their own nervous system.
Yeah. Yeah, I could totally see that. Um, are there any contraindications for doing this type of work with someone?
Somebody who, who has cancer, depending on stage of cancer and if they're undergoing, what type of treatment they're undergoing. Pregnancy, sometimes before the 20th week. Somebody who's going, drug abuse. So kind of so those might be some contraindications of people who might not be a good time for them to seek this type of work. Like with the cancer person, you just don't, and with the pregnancy, it's kind of like you don't want to stir up more things that are going on. It would be beneficial, like after they're done kind of with treatment, or after the 20th week of pregnancy, for them to then come in and find somebody with a substance abuse issue, depending on where they're at. If they're, just kind of coming to it, it might not be the best time for them to seek treatment. As it would kind of pull up a lot of stuff. Somebody who's in a acute phase of illness, just because their body's already processing a lot, and then to stir things up even more can kind of put them into a healing crisis. So you want it to kind of stabilize a little bit.
Yes, yes. And I remember I trained as a massage therapist many, many years ago, and we were told with cancer that we didn't want to spread the cancer, that by doing lymphatic work and things like that in particular. So yeah, that totally makes sense. I have heard from folks who have had this work done that actually sometimes insurance will pay for it if you have maybe a referral from a primary care doctor, something like that. Do you find that this is something that people can get coverage for, or is it generally an out-of-pocket type expense?
I know for general physical therapy, you can find a physical therapist who specializes in pelvic floor therapy. Depending on what you want, and the therapist, they can do some of the physical floor therapists do pelvic health and are very beneficial. Some of them do internal work, some of them don't. So depending on what the person is looking for, they can look at that. Insurance usually does cover that sort of referral. Also, sometimes too, for the pelvic floor work, the holistic pelvic care depends on the practitioner and what insurance they take. So it would definitely be something for somebody to look in, contact their insurance company, contact the provider that they're thinking about seeing, asking if they accept insurance. I think I think it just depends. Some people take insurance, and some people don't. Yeah.
I wanted to just put that out there because I don't think people knew. I wouldn't have necessarily thought that this was something that the sort of traditional medicine, Western medicine world would even consider. But I do have understood that from my PT friend that actually, that oftentimes insurance will pay for it because it's related to it's a medical necessity type thing. It's related to a condition that they're already getting treated potentially with a practitioner, right?
Yes, absolutely.
Yeah.
So it is
Cool.
something covered.
That's really great to hear. The other question I wanted just to find a little bit more out about was the shamanic work that you do. Tell us tell us about that and how that weaves into this work.
So the shamanic work, as tend to work on somebody, whether I'm working on them physically or energetically, sometimes things will come up for myself where I'm working on somebody and I will start to get an image of, something that maybe happened in their childhood and so we'll bring that aspect into the session if people are open to it. And as far as the shamanic work, sometimes it's kind of reclaiming a piece of your soul, or it could be kind of the opposite, where somebody looking at the pelvic bowl, let's say somebody's looking at fertility issues and they're trying to get pregnant, but they're having a hard time with it. And we start looking at it, but they've been caring for their own mom or their own dad or something like that. And their energy is sitting in their pelvis. And so there's no room for them to conceive a new life. And so we will work on energetically releasing, that energy from their body and their aura so that they can create space for, a new life and a different type of mothering to occur. Or like I was saying, like a childhood wound or trauma, it comes up, and then we will take that 8-year-old self and bring that piece of them back in to regain more wholeness within their system. So that's kind of an example or a couple examples of how that ties into this work.
I love it.
And also just breath work and just the clearing out of old.
That's really wonderful. Yeah, I love this work that you're doing, because I think that when people, particularly with trauma, again, being a trauma specialist, we talk about it and we may do energetic work and in different ways, but sometimes we're not dealing with the body, what role the body had in that trauma, particularly like sexual abuse. The body endured a really sometimes severe or awful trauma, and to be able to work directly with it in this kind of intimate way that wouldn't be available, for instance, to me, working with someone. I love the idea that there are folks like you out there that I could partner with or collaborate with, so that my clients who have had this type of abuse might be able to really, because a lot of times I see, we have clients, I also specialize in addiction, and we have ladies who can't have sex without being under the influence, or who are numb in their genitals or that part of their body because there's been some kind of abuse, and so they're not even really enjoying sex, even if they might feel like they have a partner that's really supportive of them and not abusive, and that's all good, but then they can't really enjoy sex with that person because of this unresolved trauma. I would imagine that the possibilities are really powerful for how that could heal and change for them with this work.
Yeah, and so they're able to come in and reclaim that own part of their body and have conversation and be able to begin to live in their pelvis, their pelvic floor, have connection, and being able to understand, their emotions and how they're feeling in that area of their body, and having communication with their own body. And then when they're able to do that, then they can kind of start to step into those types of relationships with their partner and have communication and it's a very gentle dance to start to tap into and weave that into their own lives, and looking at their own patterns of, what's causing them to shut down, connecting back into their emotions of how I'm feeling. And sometimes just working with having that really gentle hands-on their own body, whether it's their own hands or somebody else's, of that gentle, nurturing touch that maybe they've never had, and being able to feel safe with that. And then eventually maybe bringing their partners in with doing that work as well, where it's maybe not even about having sex, it's about being comfortable with just that touch and safety.
Yes. Yeah. I mean, even just as women, going to the gynecologist and getting an exam, it's so sterile and cold, and it does feel invasive. There isn't always like a gentleness or kindness in that touch. It can be very clinical. And I think that the same is true for women who are pregnant and having babies. It's very just, there isn't a lot of kind energy directed at this part of the body sometimes.
Yes, and I agree. And my wish would be that more clinicians would, kind of slow down and meet people where they're at. And I feel like it is getting better, but it varies definitely across the board or where you are in the world. And having more presence and compassion and gentleness with working with women in the healthcare setting.
Yes.
Because
Yes.
it can be very traumatic. And speaking with working with women in the healthcare care setting, with being a nurse and delivery, postpartum nurse, if you can step back, slow down, go slow, work with the client, bringing their guided breath in while they're, getting an exam, it really helps decrease that anxiety, the pain, makes it tolerable, and makes the whole situation non-traumatic or a lot less traumatic, and bringing them in as a partner so that they're partnering with it rather than just having something done to their body.
That's what it feels like sometimes. Yeah, exactly. Yeah. So that kind of brings me to the question I often like to ask folks is like, what would you like to see as the future, for healthcare with all of this? What would be your vision for how pelvic healthcare gets included maybe more in how we look at people really and treat them?
Yeah, I would really love, like I was saying, to have clinicians being able to kind of slow down a little bit sometimes if the client or patient is needing it, for women to really be empowered in their own bodies to, like when they go in, to say, hey, I need you to, this is, a little harder or traumatic. Can we slow down a little bit rather than just being like, they're the doctor and they're doing what they need to do, which the doctors sometimes also do, but more about partnering with that, working together. As far as the pelvic care, I would, I think every woman that's had a baby should go and see a pelvic floor therapist afterward. Also teaching our young children, our girls, how to take care of their bodies, what their pelvic organs are, how they work, what, like what's going on there. The energy of the uterus, like we think about our pelvic floor organs usually only for sex or having a baby, and it's kind of done, but it's a portal within our body that holds all of this creative energy that you can draw upon when you're trying to do something else creative in your life, whether it's a new job, an art project, it could be anything, gardening, whatever it is that you're trying to create in your life, you can tap into those energies of the uterus and the ovaries to birth, so to speak, new energies into physical form. And when you are able to go in and connect with your body in that way and have presence in your body, it can change things in your life profoundly. Yeah. And I would like to see more women empowered, feeling comfortable and strong and whole in their own bodies.
I love that. And I share that vision with you. And you're just reminding me of the chakras, right? Like the second chakra, which is the sexual chakra, is a big part of it, is creativity, not just creating babies, but creating all kinds of other things. And the first chakra, the root chakra, is very much about safety. And so when when we don't feel safe, then there often can be issues in that part of the body, and for people to know that this type of therapy is available to them to support them in healing whatever's going on, whatever energies are imbalanced, like you talked about, or whatever, if there's been trauma there, or just a general, so many women are just like, ew, about this part of their body. If we could empower them to have a different relationship with overall bodies, but particularly that part of our bodies, I think that would be such a wonderful thing to have in the world,
Yeah.
Yeah.
Yeah. And we have been, I think, it's almost like trained to pull back from that part of the body, like you're saying, ooh, but there's so much power in that part of your body that it is keeping us disempowered from, and it kind of takes our power away. And if you can reclaim that back, how much more presence, how much more can you do, and move forward?
Right. Right. Like I'm thinking about like in ancient times, how I now have heard this has been debunked, but the idea of the chastity belt, like what a concept, that you don't even own that part of your body, that someone else owns it. I think that might come up with some of the energy work. I know it has for when I've worked with folks where, like someone else, you don't have sovereignty over that part of your body. Somebody else owns it, right? Like there's a lot we could do to unravel some of that for folks and give women, exactly you said, give them their power back. I love that. Yeah.
And that would be, I would love for people to, and women to own that part of their body back, their whole bodies. And like you were saying, to claim it, move forward, and be, I would say, creative in their life. Sorry, I just lost my train of thought.
That's it. I think you've spoken beautifully on this topic. Kari, if people want to find out more about you and your work, where would you suggest that they go?
For me personally, I have a website that is womenswisdomseattle.com if they wanted to find me or find more about my work. A couple, I'm up in the Seattle area. I also do energetic work, online Zoom. If somebody wanted to meet virtually, we could do that. Or just pelvic, look up pelvic floor therapists for somebody in your area. Not all of them do, more of the energy shamanic type work, but even structurally and getting in and getting those organs balanced out, the structures balanced out. I mean, that is incredible work. In and of itself. Tammy Kent, who is my teacher, she's written a couple books, Wild Feminine, Mothering from Your Center, and Wild Creative, I think are the three that she's written now. Those are great books to start tapping into that are looking at your feminine field and ways to start thinking about your own femininity and your own creativity. And how you go about your life to kind of reclaim your feminine ground.
Love
and also
it.
The other one would be Mayan Abdominal, or Vigo Mayan Abdominal Therapy would be another place that people could look to.
Wonderful.
Yeah.
Wonderful. We're going to put all these links in the show notes so people can know where to find them. And it's been really amazing having this conversation with you. It's something that, again, doesn't often get spoken about. Even especially in a public kind of forum. So I really hope that we can get more of this information out in the world and really empower people out there to know that there is this whole world of holistic pelvic health that you could explore, and that might help you if you have some of the issues that we've spoken about today. Any final thoughts for us before we wrap this up?
Not particular. I was just going to say, you don't have to live with, you just have to live with that. There's so many modalities and so much help out there, and finding your own path, your own way, and tapping into your own body for its knowledge and wisdom and what it's asking for. So I really appreciate your time and having me on and being able to talk about this so that we can open it up to more people finding out about this type of work and therapy and healing in the world. So thank you very much.
Thank you. And thanks everyone who tuned in today. If you liked this podcast, please do share it with others. Subscribe to the podcast, put reviews in there. All of those things will help us get this really valuable info out there in the world for the people who are looking for it. So see you next time on Kaleidoscope of Possibilities. Thank you for joining me for this episode of Kaleidoscope of Possibilities, Alternative Perspectives on Mental Health. This has been Dr. Adriana Popescu. If you enjoyed this episode, please like and subscribe and share with others. To find out more about me, my guests, and more, please visit my website at adrianapopescu.org. See you next time!